Michael, we were talking earlier about the treatments that you had for your bladder cancer with the BCG installations, which unfortunately for you, despite going through 12 of these treatments, didn't control the cancer, and you then went on to make a very big decision to have your bladder removed.
Correct.
Tell us about that. That's a huge leap from going from bladder installations to major surgery.
Not that I had to make that decision. Pretty much felt like it's the only option at this point. Listening to the medical professionals say, here's where we're at and here's what we recommend. So I put my trust in the medical field.
And when you first heard about the surgery and they explained it to you, what did they tell you about what the surgery involved?
Removing the bladder, and two options at that point. I know a little bit more now. Now I could say ileoconduit, which at the time I didn't know what that meant, and or a neobladder. And it was explained the two different types, that the ileoconduit requires an appliance outside the body. That's where your urine is collected. And or the neobladder, which they'll build or reconstruct your bladder, if you will, from intestine and connect that to your urethra, and you'll still be.
So essentially you're saying that the first part of the surgery was to remove the diseased bladder.
Yes.
And then part two of the surgery
Correct.
was to create a new
bladder.
reservoir for your urine from the kidneys to run into.
Very well put, yes.
Now the surgery, having your bladder removed, and you talked about these two options, was
scary.
Huge operation physically and emotionally, yes?
Mm-hmm. Yeah, very scary. Reality sets in that your life is about to change big time. Not that just a diagnosis of cancer doesn't do that, but now I'm going to be physically altered from it.
Do you feel when the surgeon was giving you these options about the bladder reconstruction, we're very good as surgeons about telling you what we're going to do and how we're going to put the plumbing back together, if
Correct.
you will, but not always so great at addressing the huge emotional overload that comes with that decision.
True, and I think you could only do so much in that regard. One of the things that I appreciated was I was afforded the opportunity to reach out to other individuals who's had this surgery, and actually I had contact information.
What did they tell you?
They said be grateful your cancer was caught early, and that you'll hear a lot of scary things about it, but really, he said, I go to work every day, I live with it, and it's second nature. This was the neobladder he was speaking of. He said to urinate, you sit down, you apply pressure to your bladder, and the urine evacuates normally.
Once you started to hear about the magnitude of the surgery that was on the table, did you start to kind of think about maybe let's have another conversation about alternative bladder preservation options? Did you think about, well, maybe this is a bit radical, maybe there's other options to try before going to surgery? Or
did not think along those lines. Did not know of any other way of resolving the problem at hand, that there were, or if there are, other options.
Right. Sandy, this is a huge decision for any patient.
Right.
When Michael heard about the surgery to remove bladder and then having to then make the decision about the option for reconstruction.
Oh yeah.
It's a huge decision.
It really was a huge decision. And the good thing is that we know people too. So we know a cancer surgeon. We have nurses who are great friends of ours, oncology nurses. When they offered, his urologist offered different surgeons that he could see, and then one of our friends who is an oncology surgeon had recommended, Fox Chase and Dr. Kudikoff and a few other places. We felt it was best to do that, get the second opinions and check out all the other options.
Right. In hindsight, having been through this, do you think that you could have been more educated by the doctors that were taking care of you? Were there areas that now you know what you know, you would be able to say to other patients approaching the same kind of surgery, this is what I would have done differently, this is where I would have gone for extra information?
No, I don't think so. I think the information that was presented to me and the path that I traveled, I think was succinct. I think it had to be that way. I don't think, I think my options were correct. Even though I chose to go with the neobladder, which obviously circumstances changed when I was on the table, but at the time I thought that was the correct choice. Now, I never had the opportunity to live with a neobladder. I ended up with the ileoconduit. And in hindsight now, I think maybe the ileoconduit is the way to go.
So Dr. Plimack, we're hearing about different options here in terms of reconstruction. The decision for a patient, male or female, to go through such radical surgery to have their bladder removed, how easy is it for patients to accept that, particularly when they've got to the point of failing where treatments are not working and they need to go on to that? Do they accept that, or do you find that a lot of patients are still very hesitant to undergo such major life and body changing surgery?
So I think our job as clinicians is to explain the situation, explain the diagnosis, and offer the option that gives patients the best chance of cure. And I think Mr. Molnar's conversation with Dr. Kudikoff were along those lines. I mean, I know exactly how he approaches high-grade T1 disease in young patients, right? The goal is we want to cure you of your bladder cancer. We're here to support you through the treatment. It isn't going to be easy. These are the different options, but if you were my family member, this is what I would recommend. And
up
so,
until that point, it was right on the money. It was only, and maybe I'm jumping the gun here, but it was only after the fact that my cancer was outside the bladder where I looked at it at a complete. Now it's like life-saving, whatever we're going to do here.
And we're hearing about the involvement of urologists and medical oncologists. Is surgery the only option? Is there a role for radiation for bladder cancer for patients?
So it depends, and again, there are a lot of different stages of bladder cancer. For high-grade T1 disease, which is what you had, it was resistant to the BCG that you'd tried before. Those tumors tend to progress to muscle invasion about 30% of the time, and they can even spread beyond the bladder. Another 30% ultimately need to have their bladder out, whether it's at the point of high-grade T1 or later, and maybe about a third can be cured with additional intravesical therapies. So most of our patients, especially young ones, don't want to take a 30% chance at cure. They want more than that, and that's where surgery comes in. So once the situation is understood and the goal of cure is established, then we really try to help patients through the journey of cancer, surgery, and recovery by thinking about what type of diversion, talking about recovery, talking about what the outcomes might be after surgery so that you have some sort of expectation going forward.
Now, before we come back to the specifics of the surgical journeys that you went through, which I know were a number of different procedures that you had, we know that bladder cancer is common. We see it all day, every day as a urologist, but there's still huge value for patients to get to the right person for the right treatment at the right time. How do we counsel patients who may be managed, for example, by a community urologist? How do they get access to a bladder cancer expert, a medical oncologist with your level of expertise in this disease? Because surely if you're seeing the right person who has expert knowledge, particularly in these newer therapies, surely that must actually affect outcome for patients.
I mean, we think it does. I'm fortunate to be able to focus my research efforts on a select number of cancers. Because I have a focus, I have less breadth. I'm not able to treat every kind of cancer, but I focus on this kind. I would say hats off to the community urologists out there who are the first responders who diagnose and treat bladder cancer. Your community urologist did an excellent job by first treating it with the BCG, which is exactly what we would have done, and then when that didn't work, referring you to an expert center that does these surgeries all the time. These are complicated, big surgeries, and being in expert hands makes sense, not just because of the technical skill, which of course comes with doing them frequently, but also the interdisciplinary approach, again, involving medical oncology as was involved in your case.
I mean, we
look at part of the team.
We look at medical studies all the time and data looking at outcomes and survival with different treatments. But Sandy, one thing that's so important, I think it's fair to say that Michael clearly had belief and faith in the doctor that was looking after him, believed that he was on the right path. How important is it, do you think, to be with someone who you feel is really the right person? Not everybody fits with the right doctor at the right time.
Right.
Sounds like the doctor-patient relationship here was very good and you were well educated. Do you feel like the doctor that was looking after Michael addressed all the relevant issues?
I believe so. We're talking about his surgeon?
But all the doctors.
All the
that have been
doctors? Oh,
involved.
yes, all the doctors. I mean, Michael had so much faith here. He could have tried another treatment at a local hospital, but when he came here, you know, accredited Cancer Institute, I believe, I think that meeting Dr. Plimack and knowing that Dr. Kudakov was as brilliant as he was as well, I mean, it just made all the difference. And his attitude was, no, I'm going with the best. I'm not staying local. I'm going somewhere where I really believe that they can help me.
As a caregiver, listening to this story unfold about going into major surgery and having to make these decisions about bladder reconstruction, possibly having a bag or stealing parts of the bowel to make a new bladder, what questions and concerns did you have at that point?
I guess I just wanted to know that he was getting the best care, and I did a little bit more background research. He really didn't want to read about anything. I mean, the doctor gave him a whole pamphlet of information, but I think him speaking with the people that he spoke with that have lived with these options, I think that was very important to him. Where for me, I'm flicking through the papers going, oh, I don't know, what about this? And, you know, and then would ask the surgeon, and he was
And did you ask for that, or was that volunteered to you by the surgeon that was taking care of you, to talk to other patients that had been through the same surgery?
That was an option brought to my attention by the surgeon, and to talk to these people who have volunteered their experiences. Yeah, that was a world of difference, talking to the people that actually had the surgery done.
Do you feel like when you went into having your bladder removed that you were as fully informed as you felt you needed to be at the time?
Yep.
pretty much. We actually had a friend too whose father
Had the same
had
surgery.
the
Neobladder.
neobladder. So we got to talk to somebody that wasn't referred by the doctor. So that was kind of another option.
Yeah, I talked to several people.